I'm Valerie Burdette. I am in course 346 Group C, recording prenatal education video number 1. For the sake of the video, I'm going to talk a little bit faster than I normally would. And also my clip on my badge just broke, so hopefully it won't fall. So knock knock, can I come in? Shut the door or the curtain depending on the situation. Hi, my name is Valerie. I am your nurse. I am here to give you some prenatal education. Is that okay? I would perform my hand hygiene if I'm going to be touching the patient or any supplies. So today I'm going to give you a little bit of info on what to expect during your pregnancy at every doctor visit. You're going to be seeing your doctor once a month until about week 28. Then twice a month, starting at about 28 to 36 weeks. And then from 36 weeks to birth, you will see your doctor once a week. During each visit, we will track your weight, your blood pressure, and we will check your urine for any bacteria that could indicate infection and proteins and other things that we need to check. And your doctor will assess your baby's growth, position, and heart rate. Now today you will take a blood test. It's an RH factor to check the level of proteins in your blood. At about week 11 to 14, we will perform a neurotranslucency ultrasound to assess the thickness of the fluid that has collected behind your baby. And this will help us, this will indicate if there's any abnormal chromosomal abnormalities such as Down syndrome. Then at week 20 we will perform an ultrasound to assess your baby's anatomy. At 24 weeks we will take a glucose tolerance test to assess for gestational diabetes. At 35 weeks, we will do a Group B swab, and if your test comes back positive, we will treat you so that you don't pass it on to your baby. At 28 weeks, we will perform a non-stress test, which will assess your baby's response to stimulation, and it will also indicate how the level of blood flow to your baby's brain. Now for your diet, you want to eat a well-balanced diet that consists of breads and grains, vegetables, fruit, dairy, and protein, and of course 8 to 10 glasses of water per day. That's very important. You want to eat at least 5 ounces of well-cooked fish per week in order to get that good, healthy omega-3 fats. You want to take a multivitamin that has 400 mcgs of folic acid. That's important for your baby's spine and brain development, and it will also reduce the risk of neural tube defects. You can also get folate from other sources like meat, like chicken, and you can get it from beans. Your multivitamin should include B12 and iron as well. Now, foods you want to avoid is foods that are high in sugar and high in sodium, like processed foods, which includes chips, crackers. Deli meat is very high in sodium. You want to avoid artificial sweeteners and foods that are high in mercury, like fish, like char and swordfish. And you want to limit your tuna intake to about 6 ounces per week. And it's important to exercise at least 20 to 30 minutes a day. Exercise will improve your muscle tone and endurance, and it will help you during labor. And of course you want to avoid contact sports such as horse riding or sit-ups. Sit-ups. You want to also avoid sit-ups, especially during your second and third trimester. Now for BMI, it would depend on the patient, so I'll go through each one. So if your BMI is 17, which is considered underweight, so by the end of your pregnancy, you want to gain anywhere from like 30 to 40 pounds. So that's going to be like by your third trimester, that's going to be about 1 pound a week. And then for a patient that has a normal BMI, I would say, so your BMI is at 20, which is considered normal. So by the end of your pregnancy, you want to have gained about 25 to 35 pounds and no more to stay in the healthy range. Now, if a patient's BMI is indicates that the patient is overweight, I would say, for example, your BMI is 27, which indicates you are overweight. So you definitely want to keep an eye on your weight gain, and you want to have only gained 15 to 25 pounds by the end of your pregnancy. Now, if a patient's BMI indicated they were obese, I would say, for example, your BMI is at 32, which is considered obese. So you want to shoot for about 11 to 20 pounds of weight gain throughout your pregnancy. So it's real important that you eat a well-balanced diet to meet that goal. You don't want to go over the 20 pounds. Now, some common complaints that women have are nausea and vomiting. And some ways you can minimize that is through eating small frequent meals. You don't want to let yourself get too hungry between meals. Drink small amounts of liquids between meals. Get some fresh air, get outside, get some fresh air. That will help. Eat your food at room temperature. And sometimes peppermint tea will help. And vitamin B6 is also known to help with nausea. Now, some women experience constipation throughout their pregnancy, and the best way to treat or avoid that is through movement. Get up, move around, exercise daily, and drink a lot of water. Women frequently experience heartburn as well, and the best way to avoid that or to treat that is eat small meals throughout the day. Don't drink a lot of liquid when you eat. Avoid spicy foods. Don't lie down right after you eat, especially if you're really full, and wear loose fitted clothing, around your chest, your belly area. Now, things to look out for that you would want to call your doctor for right away are hyperemesis, which is persistent nausea and vomiting. So if you experience that 3 to 4 times a day and it prevents you from being able to hold down any food or drinks, then you want to call your doctor immediately. If you experience any spotting or bleeding, no matter how much, call your doctor immediately. And look out for signs of gestational diabetes, which is high blood sugar. So if you're experiencing any unusual thirst, you're not urinating very much. I mean, you're urinating, but not a lot comes out. And if you experience any fatigue. So kind of those 3 things, if you feel those are unusual, go ahead and call your doctor immediately. Do you have any questions? I would answer any questions. Depending on the patient, like if the patient seemed to really not be paying attention, I might ask some questions or ask her to repeat the questions or the answers just to kind of make sure she's listening. And then I would let the patient know that at the end of the visit, we'll give you all this information. I know it's a lot of information. We'll give it to you all on paper to take home with you. And that's it.